Hi, everyone. Thank you for taking the time to listen to our first ever podcast session with the UKMSSNA organisation. We would like to do this podcast following CMSC conference. So just a bit of background, CMSC stands for Consortium of Multiple Sclerosis Centre. CMSC is an international conference for the US and their global partners. Many healthcare professionals working in the field of MS attend this conference, and actually this year there's 1,600 attendees, and the conference was held in Washington, D.C. We're fortunate enough to receive sponsorship to attend this conference. There's 4 committee members, and Jenny, who's one of our members, has also attended the conference. We have collectively discussed and agreed that we have a responsibility to feed back to our members back in the UK following this conference. So let's kick things off by introducing ourselves.
Hi, so I'm Jenny. I'm a multiple sclerosis nurse in London, England.
Hi, I'm Rachel Morrison, and I'm an MS specialist nurse based in the borders of Scotland.
And I'm Mavis. I'm the co-chair of UKMSSNA, and I'm the MS lead nurse in Southampton. Right. So, Jenny, covering the sessions that you've attended, what's the session that inspired you the most?
So I think the session that inspired me the most was the session on neuroanatomy, because although I had a good understanding of neuroanatomy prior to the conference, I think I didn't necessarily apply that to my practice, and I found it really helpful the way they explained the neuroanatomy, particularly the sort of analogy of avenues and streets, and how that can be used to help localise symptoms to a specific part of the anatomy.
Okay. Were there any sessions that you would have wanted to attend that wasn't part of the programme?
I think it would have been really good to have some sessions where nurses came together from around the world to discuss their different practice and sort of share best practice around the world for multiple sclerosis. I think that would be a really good way of sharing ideas and sharing practice between different practitioners.
Okay. And what do you think, were there any sessions here at CMSC that we should be doing back home in the UK?
I think a lot of them would be really fantastic to replicate in the UK. I would love to have a session on neuroanatomy like the one we had, and also the LGBTQ session that we had was really insightful, and I think would be helpful for all healthcare professionals, not just MS nurses.
Okay, great. How about you, Rachel? What particular session inspired you the most?
I really enjoyed the LGBTQ plus session. I found it really interesting, and it was broken down into really manageable kind of chunks for us to take on board. I think it's something that we could share the slides with our colleagues in the UKMSSNA to allow them to have reference to them, because they were really simple to follow.
Yeah.
I really enjoyed hearing that about the impact the treatments may have on MS treatments and the interactions, and that basically the take home was to treat people that are going through transition as a normal. Sorry, take that out of it.
Yeah.
That they should just be treated as if they weren't transitioning, just and the treatments aren't going to interact with their hormone replacement therapy.
Can I just add to that, Rachel? I think one of the other really important things from that session is that there is some evidence and some ongoing trials that the hormone drugs that some people might go on through transition can actually be neuroprotective and actually be beneficial for people with MS, which was really interesting.
Yeah, that's really interesting. Yeah. And Rachel, were there any sessions that you would have wanted to attend that wasn't part of the programme?
I think I would like to see maybe more practical sessions where we are learning more practical skills to take back into our roles. Like what Jenny said there about sharing best practice. I think it's really important that we do,
I think so too,
sharing, different assessments and things like that people have developed over here that maybe.
Yeah. Maybe there's an element as well that it's difficult sometimes to transfer those practical sessions across the globe. But I think a focus on some practical sessions will be very helpful. And what sessions here at the conference you would, want us to do back in the UK?
I think, as I said about the LGBTQ plus session, I think it was really just so simple to follow, and got my head around a lot of the things that previously I'd kind of struggled to get my head around. And I think, as Jenny said there, it was something that would, not just for an MS specialist nurse, but for all healthcare professionals and anybody, I think it would be a really positive experience.
Great. From my point of view, I think my favourite session was around the future workforce in MS. It totally surprised me, I have to say, because, in the UK we have a very, wide MDT in terms of, doctors, nurses, OTs, physios, pharmacists, coordinators. But I was not expecting what the lecturer was going to say, and he said that the future of MS is having a biostatistician in your team, which, I have never even considered that. But data is really power. Data is where the future is. I think if we don't collect data, then we don't know what the future needs of our patients will be. So I think that was probably the most inspiring session for me.
And I think that's something the NHS will have to embrace, because I don't think we have many, or at least that I know of, many biostatisticians within the NHS, but it sounds like it'll be really important. Yeah,
and he actually made a joke saying that, how many kids say, I want to be a biostatistician when I grow up. So it is definitely a field that is going to be critical in the field of healthcare.
Well, looking at the GEMS project, where we collected a lot of data, and that was really instrumental in going up to management level, because that is what we need to have, is that evidence to present.
Yeah, and numbers do talk,
Definitely.
And in terms of the session that I would have wanted to attend, that I felt that was lacking in the conference, so a couple of years ago, or more than that now, there was a session around the MS prodrome, and it is still something that's quite elusive, I think, and people don't understand it fully. So I would have wanted to see something about that. And again, this will be the session that I would like to take back to the UK to have more discussion around the MS prodrome, because we have all heard the stories from our patients. They've been to their GPs 3-5 years before their diagnosis, and we're missing perhaps those red flags, and we need to diagnose early, because we all know that the earlier you get diagnosed, you start treatment, the better the outcomes will be. Was there anything else, do you think, that you want to add?
I think the way it was done was really good. So I was quite worried to begin with that a lot of the sessions would be very Americanized and based on American healthcare protocols, and it didn't feel like that at all. Actually, it was very approachable and applicable to our practice. So I thought that was really good.
Because this is your first CMSC, isn't it?
It is, yeah. It's been a bit, it's very busy. There's a lot going on, but really enjoyable.
Yeah. Any last words, Rachel?
I just thoroughly enjoyed the sessions, and just some of the sessions that were on at the same time. I would have liked to have gone to both of them, but that's just the way of it. You've just got to choose what you can go to.
Great. So thank you very much, Jenny. Thank you, Rachel. And thank you again for listening and taking the time to listen to our first ever podcast. We're all very excited about it. If you can give us any feedback, we would really appreciate it. And if you think that we should be doing more of this in the future. Bye, everyone.
Bye.
Bye.